Welcome back. This morning we're discussing the state of nursing and home health care in Connecticut. We welcome Sasa Harriott, the president and CEO of Harriott Health Services, and Deputy Pro Tempore State Senator Saud Anwar, the chair of the Public Health Committee. Of course, also a physician. Thank you both so much for being with us.
Thank you.
First, I wanted to start with you, Sasa. Talk a little bit more about the forum and why you thought it was so important to hold it.
Thank you. Today's forum is to help to shed light on the risk that home healthcare nurses face every day as we try to care for those who need us the most in underserved communities throughout the state. We want to work with the Black and Puerto Rican Caucus and other stakeholders to ensure that we improve the outcomes for the communities that we serve and also maintain the safety of nurses.
What do you want to see to happen to protect home health care nurses even more?
Well, first, we need better access to ACT and mobile crisis teams throughout the state. We need better discharge processes or synchronicity between care when someone may be transitioning from corrections, hospitals, long-term care facilities, back to home health. And we also want to discuss the reimbursement rates for nurses that provide services to multi-generational homes throughout the state. Whereas if we have a home where multiple family members might share that home, we want to discuss why the value of that care is reduced compared to in other communities where that's not the same.
I have to imagine you're hearing from a lot of home health care nurses, and they're quite concerned.
Yes, they are. You know, when nurses show up to a home and we're uncertain what's going to happen
what
once
they're walking
we enter.
into.
Yeah,
right.
We're uncertain. Yes, it's a scary thing, but we have to show up, right? And we have to care for people no matter what their situation or circumstances are.
Mm-hmm. Senator Anwar, what are your thoughts on these safety measures and what else needs to be done? How quickly should legislators be acting?
Well, everybody in the state of Connecticut deserves to get care, but every healthcare worker should be protected. And we have seen the home healthcare workers have not had the protections. If you'd ask them, almost 65% have had some level of verbal abuse, 44% have had physical abuse, and they don't feel safe in some of the environment. We as a state have to do better because, first of all, there's a shortage of nurses and all healthcare workers. And we need 3,000 or so nurses every year to take care of the needs at the bedside, but also in the home care arena. And how can we get more people to choose this as a profession if we cannot promise them safety? So this is a top priority. We have to address this.
Now, unfortunately, a home health care worker was killed recently on the job. Certainly, it's been in headlines, dominating headlines a lot, but this is not something that's new. This has been happening for a long time as far as being threatened, being unsure of their working conditions.
Yes, and first of all, my heartfelt condolences to the victims and the families affected by this horrific incident. It could have been any of us. It could have been any of us, and that's why it's imperative that we have this discussion today to discuss the safety of all home care providers to ensure that something like this never happens again.
What would you say the role of law enforcement is in securing their safety?
We are all in this together. We need to actually have a transparency and understanding the risks. Anytime a healthcare worker goes to a home, they need a lot more information than what they have right now. Transparency of all the data, what are the risks, what they're going to endure, and also having a mechanism to be able to call for help, and in some high-risk situation, having somebody go with them to make sure they're protected. We have to make this into a law and make sure we put resources behind it too.
Now, Sasa, the forum is happening today. What's next? What can people expect?
What's next is we will work with leadership, the community. We will hear from the community, and we will ensure that some of the flaws in the system, we address them. And, you know, the biggest goal is to ensure that there's a voice for nurses and the community that might rely on the nurses to be able to express ways that we can come together and do better, you know, do a better job.
Absolutely. Like you said, everybody deserves to have a safe and secure workplace and to feel good about where they're going to their job. Thank you so much for being with us, both of you.